I'm John Nicholson, an internist. I work with Iredell Health Systems. We have practiced Nicholson Internal Medicine on Hartness Road. I grew up relatively locally. I grew up in Charlotte. My grandparents lived in Statesville. I would visit them. I enjoyed coming to the town. It was a small town that gave me a different look than Charlotte, and gave me a connection to the area. I grew up in Charlotte, went to Chapel Hill as an undergraduate, and then went to Duke for medical school, and went on to the University of Iowa, and thereafter wanted to come back to the Piedmont area and wanted to come back to my grandparents' hometown. So that's what brought me here. For me, one of the focuses is to try to listen to the patient and try to find a solution that they're satisfied with, such as that we could manage a problem one way or another and try to incorporate their thoughts in their care too, and also to try to explain things fairly well to them. They may not remember everything I say, but I feel like they are involved in their care, and I would rather not dictate care. I'd rather work with the patient to find something that's going to be acceptable. Well, as a medical student, I did have an interest to things like family medicine. At Duke, you had to kind of choose where you were headed. In fact, I was on the family medicine sort of club that they had at the medical school. But internal medicine offered you a little more focus, a little deeper care, a little more complex hospital training, and allowed you to go into other subspecialties. And at that point, I thought that I was probably going to be a primary care physician, but was open to the idea of considering other things. I particularly liked infectious disease and pulmonary medicine. Well, our office's focus is to listen to the patients, to hear what they say, beyond what I give them and do otherwise. I enjoy very much working with Iredell. I've worked in different settings in the past, worked in my own office, I've worked with other physician groups, and I appreciate the fact that Iredell has being a community-based hospital and a not-for-profit, has the community's health interest in mind.